Metabolic syndrome. What is it? Welcome to Metabolic Talks. I am Dr. Kabongo. In this video, I will talk about the metabolic syndrome and how it can affect your health. Metabolic syndrome is simply a cluster of signs that usually include abdominal overweight, belly fat, rising blood pressure, rising blood sugar, and bad cholesterol. While good cholesterol goes down, fatigue is also commonly present. Many people are familiar with hypertension, diabetes, and being overweight, but all these problems usually have a single root cause: sugar. Sugar comes in many shapes and forms. We tend to think only of the sugar we add to food, but it exists in many forms. For example, potatoes, bread, rice, pasta, sugar are all sources of sugar. The body stores this somewhere. So this is how the issue begins: the problem of storing more energy than we need. The body doesn't know what to do with all the energy we consume, mainly carbohydrates, sugar. So what does it do? It stores it. And this storage usually happens as visceral fat. Previously, we discussed factors that contribute to this. Eating highly refined foods, where carbohydrates are quickly digested and spike blood sugar. Then insulin, produced by the pancreas, an organ behind the stomach, comes into play. Its role is to move sugar from the blood into cells, especially into fat cells around the organs between the intestines. This is what we call visceral fat, one of the most harmful types of fat. Once fat is stored here, everything begins. Visceral fat is not harmless. It behaves like an organ that produces its own hormones and other chemicals that cause low-grade inflammation. This triggers a cascade leading to hypertension, diabetes, PCOS, and many other complications. It is being estimated that 70 to 80% of all known chronic diseases are complications of this process of metabolic syndrome. Visceral fat starts producing substances that cause inflammation. When this inflammation becomes widespread, it affects all organs: the brain, arteries, kidneys, liver, everywhere. In the arteries, serious problems arise. Inflammation affects the inner lining, intima, of all arteries, large and small, even tiny capillaries. These vessels can become blocked due to inflammation. Bad cholesterol particles enter these inflamed areas and get stuck. Blood cells try to repair the damage, and calcium can deposit there, gradually clogging the vessel. If a vessel in the heart gets blocked, heart attack. If it happens in the brain, stroke. Blood flow decreases throughout the body. For example, in the genital organs, especially in men, it can lead to sexual dysfunction because blood no longer flows properly. Sometimes this is how the condition is first discovered. It is often silent until complications appear. Wherever blood flows, there will be consequences. Here are some complications: cardiovascular complications, heart disease, for example, heart attack, intermittent claudication, leg pain when walking due to poor blood flow, heart failure, atrial fibrillation, irregular heartbeat causing clots that can lead to stroke, microvascular disease affecting the retina, kidneys, and brain. Arteries also become stiff, arterial rigidity, losing their ability to expand with each heartbeat, contributing to high blood pressure. There is also reduced production of nitric oxide, a molecule that helps blood vessels dilate. Drugs like Viagra work by preserving nitric oxide, improving blood flow, especially in sexual function. When nitric oxide production drops, circulation suffers. Endocrine hormonal effects. Type 2 diabetes, high cholesterol, which contributes to clogged vessels, polycystic ovary syndrome, PCOS. Women may struggle to conceive. Increased insulin stimulates male hormone production. Symptoms include facial hair, missed periods, weight gain. In men, abdominal fat converts testosterone into estrogen. This leads to fatigue, muscle loss, low motivation, and reduced vitality. Liver and digestive system. Fatty liver disease. Fat accumulates in the liver, can slow digestion, in severe cases may progress to liver cancer. Other issues: liver fibrosis and cirrhosis, kidney system, chronic kidney disease, diabetic, nephropathy, protein loss in urine, kidney stones, neurological system, stroke due to blocked blood flow in the brain, cognitive decline, memory problems, Alzheimer's disease in advanced cases. In short, metabolic syndrome triggers widespread inflammation and damage throughout the body, affecting nearly every system and leading to serious long-term complications. If this video helped you understand your body better, share it with someone you care about, because this knowledge can prevent serious disease. And don't forget to subscribe for more content on health, prevention, and living better.